So just to say very briefly then, I'm Professor Andrea Wigfield. I work at Sheffield Hallam University. I'm Director of both the Centre for Learning Studies and co-director of the Campaign to End Loneliness. I've been researching in loneliness for about 10 years specifically, and I look really from a sociological perspective, so looking at the wider societal influences of loneliness. I'll hand over to Antonia now.
Yeah, hi everyone. So nice to see so many of you today. I'm an associate professor in psychology, and my work involves mainly understanding loneliness and mental health difficulties. I have been particularly interested in chronic loneliness during the past 2-3 years, and I work across age groups. Another part that stems from chronic loneliness is also understanding and evaluating interventions on loneliness. So today I will be talking a little bit about the definition of chronic loneliness, which hopefully will be a bit more interactive. So we have a little bit of an engagement activity for you this morning. Then I'm going to touch upon the importance of chronic loneliness and how we can measure that if we can, and what approaches have been taken. And I'm not going to talk only about our research. I'm going to try and bring some examples from international research, but also UK-based research. And then hopefully, and with an attempt to operationalize loneliness, and if we can redefine or just shed a little bit more light into what it means. And hopefully we can do that together. Okay, so we are going to start with a little activity just to warm everybody up. So I would ask, if I can kindly ask you, so you can all see my screen. So there is a big QR code on here. And if you can scan that with your phones, or I think, Emma, you've already put in the chat the link to WooClub, and there is an event code as well. And just try and have a go at this one question. So just try and add some words there. You can. I'll allow a little bit of time. So what is chronic loneliness? Just random words would be nice. Anything that comes to mind? Have we been able to?
Antonia, I think just leave the code on a bit longer.
Yeah.
It doesn't seem to be working. I don't know why it was working yesterday.
Okay, if it's not working, can we just add some?
Hi, it is working. Sorry to jump in. Hi, Antonia. If you leave it to this page, we now can answer. If you go back to the QR code, we can't.
Okay, sorry.
Just click next, then we can start adding. Yeah, right there.
Okay, that's fine. Yeah. Thank you.
Sure.
Oh, great. Brilliant. It's coming up now. Thank you. That's perfect. Some really nice words coming up. Amazing. Lovely. Yep, so that's our kind of our cloud today, our word cloud. And if you notice, the words that are in the center and are slightly larger are the ones that are most commonly used. So we're talking about isolation, prolonged. So that means that there is an element of time, and obviously there would be. There are other words that are coming up: disconnection, persistent, unhealthy, sustain, withdrawn, absence, hopelessness. There are so many different words. And the reason why I wanted to start with this cloud, this word cloud, is precisely to show that there is such a big variety of definitions and expressions that link to chronic loneliness. And this might come from your own experiences, or they might come from people you work with. So, and there are obviously some related terms like anxiety, some mental health issues are coming up, disengagement, and so on. So let's hope by the end of today that we might come into a bit more consensus about what it is. So I'm going to exit the word cloud. Thank you very much for participating. And I'm going to come back to the slides. Hopefully you can see my slides again. And as you've seen, so there are a lot of definitions and a lot of words that capture the topic of chronic loneliness. So I've just picked a few examples. There are many more that we can draw from, but I've picked a few examples. So from the Community Life Survey, which is the evidence source of 16+ people in the UK, the definition of chronically lonely are those who feel lonely often or always, and that represents about 6%. If we look at a different type of study, like the Understanding Society, the longitudinal household panel study, they identify chronic loneliness as those who feel lonely often. So that raises slightly the percentage to 9%. And I'm going to go back to 1982 from Young, just to show you that this term, or chronic loneliness, is something that has been discussed over the years, and it's been around for many, many years. It's not a new thing. So in 1982, Young distinguished between transient, what is short-term, and chronic loneliness. And he suggested that it was individuals that were not satisfied with their social interactions for more than 2 years. So there's an element of time again, but this is kind of defined as 2 years. And then again, a little bit more recent data, chronic loneliness is more stable and results from the inability to develop satisfying social relationships over the years again. So again, these are examples of a time-related approach to chronic loneliness. And this is an extract from a private mental health service describing loneliness, where we go a little bit beyond the time concept. So constant and unrelenting feelings of being alone, isolated, difficulties in forming meaningful social connections, which we all know are part of the feelings of loneliness, and exhaustion when trying to engage socially. So bringing a little bit more qualitative aspects to chronic loneliness. And then this is a recent paper by Alam and colleagues, and our colleague Jennifer Law was part of that. And this is a description that I've copied from young people describing chronic loneliness. So it's this feeling when you can't even properly describe in words fully. It's always present. So always, a sense of always being present, and very tough. So there is an affective component, an intensity component, so empty inside or feeling isolated. And then there's also like an expression of a physiological response to that, like a sinking feeling in my chest, everything feels heavier. So these are just a few of the examples I wanted to bring about, just to get us a little bit to understand what it is that we are going to talk about today. But more importantly, why is chronic loneliness so important, and why has it been around for years, and why have people, still have a very much unclear idea what it is? So why is it important? It's important to understand when and how what we call aloneness, which is the positive emotion of feeling of being alone, becomes distressing. And when that becomes distressing, are there any tipping points? And we'll come back to those tipping points a bit later in the presentation today. Why is it important? Well, it's important because no matter how it is defined or measured, there is consistent evidence that lonely individuals, particularly those that are chronically lonely across all age groups, report higher levels of negative affects or negative emotions, higher levels of mental health outcomes like symptoms of depression and anxiety, and low self-worth. So this brings chronic loneliness as very central to the mental health agenda across the world and across age groups. There are important implications for physical and mental health. And it's also important because if we understand what chronic loneliness is, or attempt an understanding, then we could start understanding more about which interventions work best for chronically lonely people. So linked to that, so I know the definition is quite a complex one, but I think we can shed some light by thinking about how we measure chronic loneliness. And often what we see and what we saw in the examples that I showed you earlier is we're talking about frequency. So how often do you feel something? And presumably if you feel something very often, that becomes a sense of chronic feeling. However, when asked in several questionnaires, how often do you feel isolated for others? There is really no time frame to that. So there's nothing to say, how often do you feel isolated from others during the past year, or during the past 6 weeks, or during the past week even? So frequency is very informative, but by itself is quite difficult, and it can be interpreted differently by different people. Now, as you've seen in the narrative descriptions of what chronic loneliness is, there are different aspects to chronic loneliness described, and they have to do with the persistence of lonely feelings. So how long have you felt isolated from others? Not only how often, but how long did that last for? And then if you think about the intensity of those feelings, how distressed did you feel from that? So chronic is often used to indicate that the experience is prolonged and persistent, like we saw in our own word cloud, over a longer period of time. But is it just that? So what I'm going to try today to do is to isolate each of these components, the element of time, the element of intensity, the element of duration, and try and see if we can see what can be a fuller picture of chronic loneliness. And I'm going to start by focusing only on chronicity, on time. And how would we understand time in the context of loneliness? There are several ways. One is, like we said, to ask people, how lonely have you felt, or how are you feeling over a period of time? But there are other types of designs where you kind of look at the effect of time, and these are called longitudinal designs. So what you tend to do in longitudinal designs is you ask the same sample of participants over time to tell you how lonely they feel. And there are two different options that you can capture. So it might be that some people are lonely at time 1, and then when you ask them 6 months later or a year later, they're not lonely. And you might have people that report being lonely at time 1 and report being lonely at time 2 and at time 3. And that might be a neat way to discriminate between what we call transient, or sometimes also called episodic loneliness, versus chronic loneliness. So that's only taking into account the time perception, duration. And let me give you an example. And I'm drawing an example from Australia, just to bring a little bit more international literature in the talk today. So in Australia, the study was done by a group of people that use the HILDA, the Household Income and Labor Dynamics. It's a way of reporting several aspects of well-being, and they drew data from 2014 to 2018. And they asked people 2 things, among other non-related to loneliness things. They asked them about their loneliness level, and they defined it as this unpleasant psychological reactions to the absence of desired social relations. So loneliness, as it has been defined by Perlam and Peplu a long time ago. And they also asked them about their social isolation experiences. So social isolation being the number of social contacts someone has. Social isolation doesn't talk about the unpleasantness of being alone. It doesn't talk about how meaningful those relationships are. It just asks you to report the number of social contacts that you have. And what they found across the waves, the waves from 2014 to 2018, is that 21% of the population of the people they examined, and these were very large cohort studies, they had episodic loneliness. That means that they were reporting being lonely in 2014, but not in 2018. From that data as well, 13% reported being lonely at both times, and they were characterized as being chronically lonely. And that's quite a large amount if you think about the intensity and the consequences of chronic loneliness. So just taking time into account, we see 13% in that particular Australian study reporting chronically lonely, being chronically lonely. And then on the right-hand side, we have the same figures for social isolation. So 13% reported being socially isolated at wave 1, so in 2014, and 4% reported being socially isolated in both waves. So as you can see, the experience of loneliness across time was more common. So chronic loneliness was more common than chronic social isolation. And that's just taking time into perspective. Now, just to zoom in on a few of the other indicators of that particular study. So being male was a protective factor for any type of loneliness, and that's quite consistent with previous research. There were some age effects in that particular study. So group number 4 were more likely to be chronically lonely, and those were middle-aged people between 30 and 45 years. There were some at-risk populations. So being single parents with young children had an elevated risk of chronic loneliness, and that comes from that particular study still. And 1 in 5 individuals with long-term health conditions met the criteria for chronic loneliness. And the criteria, just a reminder, being that they reported being lonely on both at both times. So that's kind of overseeing, if we disregard everything else and just take time into perspective. But I wanted to go a little bit beyond that today and talk about the experience of loneliness. And I'm going to draw some information from one of our studies that we did here in the UK. So we recruited almost 500 adults across age groups in an online survey that we did here in the UK. And we looked at what we call the emotional burden of loneliness. And what does that mean? So how did we measure this emotional burden or this emotional experience of loneliness? So we asked participants from different age groups, how often do you feel that you lack companionship? And that's one of the items of the UCLA. And we did the same for all of the 10 items of the UCLA. So the 10 items were rated across the 3 dimensions that I will just explain. So we said, how often do you feel lonely? And we addressed frequency from never to often. Then we asked them, how did this make you feel? And we gave them the option of low intensity, so not very intense, to very high intensity, so 0 to 100. And then we also asked them whether this was pleasant or unpleasant, so whether it was a positive or a negative experience. And again, we gave them that option. And we did this across all of the 10 items of the UCLA loneliness scale. And we tried to capture not only how often something happens, so the frequency, but also the intensity and the pleasantness and the emotional valence of this experience. And this is what the main findings are. So there was a positive relationship between emotional intensity, frequency, and symptoms of depression and anxiety. So the more intense that emotional experience was, the more frequent it was, the higher the levels of symptoms of depression and anxiety. Although males and females did not differ on how often, so the frequency of loneliness, they did differ in the emotional aspect of loneliness, with females expressing higher intensity in their loneliness experience compared to males. And we also found some age effects. So younger adults reported experiencing significantly greater emotional intelligence than middle and older adults. And this is just a graph showing that. So if you see this graph starting from the ages of 18 to 24, going down, you'll see that the higher scores of this emotional burden is in the age group of 18 to 24, unlike the Australian study that only took into account time. So we're starting to think now a little bit more beyond time. And also, if you can see, there's another age group, 75 plus, that is also experiencing quite high levels of emotional burden. So young people and older people, although this was not captured, for example, in that Australian study when they were looking at only the time perspective of chronic loneliness. And I wanted to bring to your attention this really, of course, this very powerful study that was done by Pamela Qualter and her colleagues and from Manchester University and Brunel University. And this was the very well-known BBC loneliness experience. And I wanted to just bring a little bit of that information into context today. So again, here, what they did is they thought about loneliness in a different way than just frequency. So they looked at frequency of loneliness, they looked at intensity of loneliness, and also duration of loneliness. So let's see what their findings suggest. So they used the 4-item UCLA scale, and they asked participants to rate on how often, again, frequency, like we said before. In addition, they were asked to rate the intensity, so how intense something is, so not at all intense to very intense. And then lastly, they also incorporated duration. So how long does that feeling last when it occurs? Right? Does it last for an hour, days, weeks, or longer? So trying to incorporate all of these aspects of loneliness within a single measure. And I don't want to get into the very technical details, but if you look at the chart on the left-hand side, there are 4 groups that are being highlighted. And this is a group that's called class 6, class 9, class 10, and 11. And they tried to profile these groups and see what happens, what are the combinations of intensity, frequency, and chronicity that might be informing what we can understand about chronic loneliness. So class 6, which was only 1.6% of the population, they had a very long duration of loneliness, but it was of average frequency and intensity. So for a long time, but quite medium level of intensity. One of the important classes was class 9. Class 9 had high frequency, high intensity, and long duration of loneliness. And I'm just going to come back to that particular group in one moment. And then we had 2 other groups, class 10 and class 11, and you can see the percentages represented there. Class 10, 2.7%, and class 11, 7.1% of the population, where they all had short and average duration, but quite high intensity. So what can we make out of these different types of loneliness within that severity group that we are looking at? And I've only drawn off some of the highlights. I'm sure everybody can read more details if they're interested, but I just thought, just for the sake of this discussion today, I will draw a little bit more information about what I felt was quite important to note. Some of the highlights, first of all, have to do with the fact that 41% of the respondents of all the people that took part, and this is about 55,000 people from the UK, thought that loneliness was sometimes a positive experience. And this is really important to highlight and really important to see. Now, all of these classes that I just described had differences in the way they felt that they could control their loneliness. And the time duration seemed to be particularly important in predicting these loneliness profiles. So there are individual differences on how loneliness persists over time, and duration seems to be indeed a very key aspect to that. But particularly for that group that had high frequency, high intensity, and long duration, which represents about 5.3% of the population of that study, what was really characteristic of them was that they spent more time alone, they experienced the most discrimination in their daily lives, and they also felt less in control of their loneliness. Now, from the same study, some other key lights that I would like to point out was that there were special populations like people with disabilities that were categorized as prolonged lonely and had little control over their loneliness levels. And there were respondents who identified as gay or bisexual that felt lonelier, but only if they felt discriminated against it. So I think these are quite important highlights to talk about later on today in this discussion. Also, the last point is being young, 16 to 24 years, single and of poor health, not feeling a sense of belongingness to the neighborhood, and having low trust to the local community are consistent risk factors for scoring high on frequency measures of loneliness. So they're being more at risk. This is another study that is adopting a longitudinal design, and this comes from Ireland. And they investigated whether chronic loneliness could predict higher levels of psychiatric distress. And because we are linking chronic loneliness to mental health today, I thought it was a good example to look at this, this evidence as well. So they used what I showed you at the beginning. So we call them waves, but they are waves 9 and 10 of the UK household study, and they analyzed the data. And you can see on the graph that chronically lonely people, that is people that were lonely, reporting lonely at wave 9 and at wave 10, where had the highest likelihood of self-reported depression diagnosis and had the highest levels of psychiatric distress compared to the two other groups, the transient lonely group and the no-lonely group. So I think that's an important aspect that links this chronic loneliness group to the to mental health. So let's try to come back. Can we operationalize chronic loneliness? And what do we need to take into account? Do we need to take into account time, intensity, mental health outcomes or symptoms, or any other components that we haven't captured already? Unfortunately, there is currently no consensus on the definition or how we can operationalize chronic loneliness. So how long should someone's loneliness be to be considered or categorized as being lonely? Yes, we've seen examples from longitudinal studies that are using time, but what is time? And time is very relevant. For example, for a young person, for a child, feeling lonely over a period of 1 month might feel very long. And for someone that's older, might feel a little. So how is time operationalized when we're talking about chronic loneliness? So is feeling lonely for a year really something qualitatively or quantitatively even different from feeling lonely for 8 months? And how can we understand that a bit more? So how meaningful would it be to develop a cutoff point as well? Is that cutoff point helpful for us? So on one hand, we might think, yes, let's put a medical lens on loneliness. Let's think about chronic loneliness and its links to mental health outcomes to bring more awareness on the issue and motivate more of those people that are feeling that way to get help. But do we run the risk of getting the opposite? So medicalizing what is universally quite a common emotional experience. Maybe it has its disadvantages as well. So we might actually encourage or disencourage people to talk about this because they feel that this is something that requires medical attention. So there is a caveat to both ways. And of course, in our discussion today, we would really welcome your input on that. We could also use experience sampling. Experience sampling is a methodology that can be used to follow people up across time. And you can check it in at various times in the day even, and you can say, how lonely do you feel right now? And that data might be rich in looking at the duration or the intensity or the unpleasantness of loneliness and what that means to people. And just going back and thinking a little bit about the tipping points and why this is all very important. So if we take into account time, okay, at what point does loneliness become problematic? Do we know that information? Well, it probably will vary from individual to individual. And what makes loneliness turn from adaptive to problematic? So some ideas that have been explored quite widely from a psychological perspective are maladaptive cognitions. So things that have to do with the self. So how you perceive yourself and how you feel about how confident you are, how high your self-worth is, like I mentioned at the beginning, and how likely are you to engage with new contexts. And then there is this really important aspect that has been discussed in the research for loneliness centers. We work a lot on life transitions to see whether they act as tipping points. And these life transitions are probably not any life transition. They would be life transitions that have an effect on your social reality and how that social reality is being harvested or hampered by those tipping points. And then there are also always links with mental health issues that might be acting as tipping points, which create vicious cycle. And then so somebody with loneliness might have mental health issues that then make them more lonely. And then they make, in turn, those feelings of loneliness make them have more maladaptive cognitions. And then life transitions act as tipping points, and again, mental health issues. So that creates a vicious cycle where people can't get out of it. So should we be disregarding the idea of time altogether, or should we be thinking of time as a continuum that will vary between people? So time perspective is an element, but it will be different for different people. And then adding a little bit more to the equation, and this is some of the research that we are starting to look at. What are the protective factors against? So 41% of those respondents in the BBC experiment said that loneliness is a positive thing. Okay. And if we draw from that information, what are those protective factors that help people reduce their loneliness? And also identifying what are the individual barriers to connecting with others, and whether social isolation is something else that we need to be considering in the aspect of chronic loneliness. So a lot of questions are bringing up, but we do have a lot of evidence that suggests that we need to talk about chronic loneliness a bit more widely. So what I would like to do, just before we come back to a more unified discussion, is I would like you to think about what we've said. So the different perspectives, the element of time, the element of intensity, frequency, and any other element that you would like to bring into this webinar. And I would like to ask you to pick a term for what you think chronic loneliness is. It could be that you might say chronic loneliness is the best term that we can use. But I've put down some terms in a polling system, and I want to see whether you still feel that this time perception is quite important, or whether you feel that there are other kind of nuances that might feed into understanding a bit more about chronic loneliness. So I'm going to make an attempt again to give you a second link, and I'm going to just give you the display. Sorry, I need to go to the second one. Just give me 1 second. Choose a name. So this is the link that you can now use, similar to the one that you used before. I'm just going to give a few moments to scan, and then I'm going to go back and display so that we can see what people are thinking. What is the best term for loneliness? And I think Emma has already put this in the chat as well, so you can vote from the chat with the event code that you see there. I'm just going to leave it a bit longer. And it's really important to think about the stigma of loneliness as well. So how can we overcome that? So avoid medicalizing, on one hand, chronic loneliness, but bringing in that element of importance much more forward than it might be until now. So let me just go back here.
So it should work for everyone now.
It should work now if you scanned. So if you can just vote which is the best name for chronic loneliness, it might be chronic loneliness, it might be something else. And I think we have, at the moment, I think nearly half of you believe that persistent loneliness is a better term than harmful, intense, and helpful. Brilliant, that's really good. So we're kind of moving away a little bit from chronic loneliness, thinking about persistent loneliness, whatever that means. So persistent loneliness might incorporate a bit more of that qualitative element, not only time, maybe. So something that persists. Okay, so shall we go back to what we plan to do about this, and going forward, what is it that we are going to do, and put some actions into place. And of course, everybody can participate in any of these ideas, and we are looking forward to your contributions, whether they are today or later on. So we have an international network working on chronic loneliness, and this involves academic and non-academic partners from across the world. And we are we're very much involved in measuring and defining, but more importantly, starting from defining chronic loneliness and measuring chronic loneliness. And obviously, if you are very interested in the topic of chronic loneliness, you're welcome to participate in our international network. We are trying to also capture qualitative descriptions of the experiences of loneliness using natural language processing. So when we look at the narratives of people that are feeling chronically lonely, to determine how those narratives can be identified and how we can pick up those words that pop out when they are expressing their experiences of loneliness. We're also working on identifying tipping points that make loneliness harmful or less pleasant. And we are also exploring barriers and facilitators to connecting with others, which might give us a lot of information on what works, what kind of interventions work and for whom. So trying to adopt this nuanced approach on loneliness research and intervention and practice. So these are some of the ongoing projects. So if you are interested in contributing to any of this, and if you want to join our international network, we do encourage you to contact us with emails provided. We can hopefully jointly have a better chance at alleviating loneliness, and hopefully we can bring a little bit more light into this topic. So I'm going to stop sharing my screen and pick up a few questions. We have over 15 minutes, which was my initial plan.
Great, thanks, Antonia. So we've got some questions in the chat, so I think I'll pass these over to you. So first, Antonia, someone asked you mentioned about operationalizing chronic loneliness, and someone's just asking you what you actually mean by that term.
So just merely defining, so trying to understand what is a meaningful way of measuring, defining, and using the term chronic loneliness. That's what we need.
And I suppose as well, because there's a theoretical view of how you might do all this, but how can you actually put it into practice, and you know, in a kind of a policy context as well as an academic.
I think there are two elements, because I think there is an element that involves clinical practitioners, because they would want some more kind of practical advice on how you do this. How do you categorize someone, or how do you define someone as chronically lonely? And within our big international network, we have clinicians working on this aspect. For policymakers, obviously, that will mean that knowing more about what it means and how it is defined and reaching a consensus, which is currently not the case, will help direct attention to that. But as I said, we don't want to medicalize chronic loneliness too much, because we run the risk of not talking about it quite widely or stigmatizing loneliness more.
Great, thanks. And then another question relating to the operationalization is around the cost and the cost of collecting this data. So somebody's asked, rather than asked, has just proposed a statement that we need to consider the cost of collecting all this data on the different aspects of chronic loneliness.
I think that there is already a lot of evidence, okay, and we don't. Some of this data doesn't need to be recollected. It's already there. We just need to look at it in more detail, break down the different groups, and kind of think about that data that exists already. So data waste is definitely not what we want to do, and we don't want to invest more money in collecting data unless it's absolutely necessary. So at the moment, there is a lot of data that we can already use. Now, whether or not we need to collect some additional data, yes, some of the studies that we're doing, for example, looking at barriers to connecting with others, they haven't been done before. So it might be important to collect some data, but we're always revisiting evidence that exists, always, and trying to use that data and not kind of collect data independently from different areas. But it's often the case that you can see cultural differences in these types of topics. So how chronic loneliness is perceived in different cultures is also informative. So we're always kind of constantly thinking of surveys being done in English or in Australia or in the UK or in the USA. We really need to see, and part of our network involves that. So we are engaging low-income countries more, trying to understand a bit more about the term chronic loneliness and how it is defined. The word might not even exist as such. So I think it's important to collect some data to understand a bit more about this. The cost of that, I don't know how to answer that really. I couldn't say what the cost is. I can certainly say that our studies are not very expensive though.
I suppose the point is about weighing up the cost of collecting the data and the benefits of having that information. And I think it relates back to your points about the connection between chronic loneliness and the mental and physical health implications, and whether by having that information we're better informed to prevent chronic loneliness and therefore have a knock-on effect on the health and social care system.
Mm-hmm.
Right, and there's also, sorry, were you going to say something?
No.
Okay. And we've got another question where you mentioned about problematic loneliness as part of the slide, and someone is asking what you actually mean by problematic loneliness.
So this is okay. So this links back to a lot of, very, very important psychological theories that talk about loneliness being an adaptive mechanism. So we absolutely need the emotion of loneliness because this is what motivates people to connect with others. There is an element that is it's a very positive thing to have, and we should all have that, and we should all experience this emotion of loneliness. So when I'm using the word problematic, it's just another way of saying, when does this stop being adaptive and it becomes maladaptive? When does that becomes a problem to society, but more importantly to the individual? And does that turn into something that is unbearable, like the descriptions that we saw at the beginning of the presentation?
Thank you. And then quite nicely, following on from that, there's another question about the fact that loneliness can be a positive experience, and what the question is about what are the positive outcomes from the loneliness? Is it that they and how do you sort of find the evidence that shows that they need to make change in terms of the social connections?
So if I understand right, the question is like, what are the aspects of positive, of why is loneliness positive and at what point? So I think that loneliness is positive because, okay, so sometimes people talk about loneliness interchangeably with being alone. Okay, so aloneness, there is an element of positivity in being alone. And even from a philosophical perspective, if you look at people or historians talking about loneliness, they have been talking about the importance of being alone and being well with yourself and reflecting on yourself. So there is an element of positivity in being alone. Now, loneliness, if let's remove the emotion of loneliness. So if, let's say that we didn't have this emotion, then we most likely wouldn't be, as social human beings, we wouldn't be motivated to connect with others. So the best scenario of being lonely is that at some point I'm sitting at home or something has happened to me, I feel lonely, and therefore I act and I do something about this. So this is the adaptive form. So that's a positive thing because it makes me reach out, pick up the phone, talk to my family, connect with people. So it should be a motivating factor. But obviously that is all good and well until it's not. And those are the tipping points or the risk factors that are putting certain people into risk of not doing what they are supposed to be, not reaching out to others. And there are various reasons of why that might be the case. So it might be that somebody has reached out and they have felt rejected. Okay, there are a lot of people that have grown from childhood feeling low self-worth, and they feel they're not good enough to meet others. And then there are other aspects that are more community-based, like I don't have anywhere to go, or I have a physical disability and I can't go. So these are exactly the barriers that I've been talking about, to identifying what is it that makes people not able to connect with others if they have the motivation to do so.
Thanks, Antonia. And I don't think I very well presented Angela's question there. So Angela, she's okay now. I just wanted to check that I would actually answer that question. Thank you. So another question is around is from Anna Topakis. Would you like to ask that question, Anna? It's about subjective time. Maybe not. Okay, so Anna's saying,
I'm in a loud room. Yeah, can you read it out?
I will do. So Anna's asking if subjective time is associated with intensity. So people who experience intense loneliness experience time differently. So for example, it might be that time goes faster or you know slower depending on those subjective experiences.
Yeah, I touched upon a little bit about when I was talking about the age group, because time is relevant, isn't it? I mean, if you're a young person, time is a few months can be a very, very big time frame, but nobody has ever looked at the actual perspective of time. So how fast time goes, because that's interesting to draw from clinical also clinical psychology, perhaps, on other conditions that are related. So, for example, does time seem to pause for someone that is that has depressive symptoms, for example? And how can we draw on that? That's a very interesting point, Anna. I think I'm going to take you up on that and look into this a bit more. Very interesting.
And then there's another point mentioned about people at Nottingham Trent University have recently done some research on the importance of belonging to different groups. And I think, well, I'll let you answer that. But
no, I think you should answer that, Andrea, because
no, I was just going to say, yes, belonging to different groups, but also belonging to community. And that community might not just be about groups of people, but it can be about place and space as well. And certainly we feel that having a sense of belonging to places and spaces is as almost, if not equal importance to having a connection to other people as well. So the way we try and look at loneliness is having a sense of connection to yourself, so being positive about yourself, which enables you to make those connections to others, having those meaningful connections to other people, and then also having a meaningful relationship with places and spaces. So yeah, we certainly agree that with that research that's carried out in Nottingham. I'm just looking if there are any more questions. So there's another point by Nick who says this feels like quite a medical scientific approach to something that is a social issue. I think actually that's what we're trying to get away from, but I'll let Antonia talk about that.
I think one of the priorities that we set as the Campaign to End Loneliness, but also at the Centre for Loneliness Studies, is we're trying to talk about loneliness a bit more widely and demedicalizing it. And I am a very big advocate of that. And me and Andrea are, one of our top priorities is, yes, to explore and understand a bit more about chronic loneliness, but also at the same time remove the barrier or the stigma talking about chronic loneliness, making this part of the discussion more widely politically, but also in the communities or in everyday life. So that's why we are very keen to remove the term chronic loneliness actually from our as chronic per se, and adopt something else like persistent or enduring loneliness, or just use different ways of expressing more qualitatively what that experience feels like, and move away from the strict measure of time, intensity, duration, valence, and so on. These are all very informative, but we want to know more about the actual experience and kind of share good practices through case studies if we can. So thanks for pointing that out.
I think there's always that balance between a scientific approach that can, provide that high level statistical correlations between a social issue and a health condition, for example, and then but then on the other side, that in-depth qualitative understanding of people's experiences. And I think that's one of the things that we're always kind of grappling with a bit.
But wouldn't it be lovely if we could find a cost-effective way where someone could, let's say, talk about their experience of loneliness, and then use sort of like, I don't know, I'm not very good with digital things, but just some way of translating into that narrative about their experience and the duration and the intensity and all of those things that we've been talking about, and making that not a diagnostic way, but just highlighting whether this person is more at risk of being chronically lonely, and therefore we should do something about that, reaching a bit more beyond the population level. I think a nuanced approach should be adopted. If it's not medicalized, that's even better.
Yeah, and then following on from that, we've got another point from James Day, who says, I think for me, chronic has always or sometimes had connotations to having to be medically treated, then possibly an over-reliance on medication rather than using a social model interventions. I think we certainly agree, but...
Yeah, definitely. Yeah, like chronic pain, like chronic conditions, you kind of associate that chronicity with something that you can't get out of, almost, something that you're stuck in and you can't get out of. And that's certainly not the way that we want to think about persistent loneliness.
Okay, so we're running a bit out of time, but we've got another question about loneliness and transitions, particularly thinking about young people aged 16 to 30 go through many transitions in that time.
I think it's important, as I mentioned earlier, to think about those transitions. They're not always going to affect your social relationships. I think it's transitions that are particularly linked to the way that your social reality works. So moving away from home is one that's quite evident. I mean, even probably changing schools might not affect your social reality because you might be moving with your cohort. But moving away from home, for example, going to another university or moving across in a different country, changing jobs, that will definitely have an impact on your social reality. Social reality, I mean more widely, the social network and so on. And at that point, we need a bit more information about whether the person is able to reconnect in that new place and develop these meaningful relationships, or whether they have underlying issues or concerns about themselves and so on, and are unable to do so. So yeah, tipping points are really important, I think.
And I think young becoming a mother, so young motherhood as well, we know is a particularly difficult time for young people, and even getting married or moving in with a partner, a romantic partner, can be, so any of those particular times of change in relationships can have a knock-on effect to other relationships. We are running out of time, and we've got some more questions in the chat, so I think we'll have to try and answer those after. I do want to just say that I think there was one question that was submitted prior to this, which was about befriending and the kind of the cost of that one-to-one support of befriending, that is possibly quite important in the role of chronic loneliness. And I think our view on that is befriending is a really positive initiative, and there's a lot of evidence to suggest that it is intensive in terms of both resource and time, and for the volunteer it can be quite difficult as well. And I think the more issues that the person has, the more challenges, the more challenging it is for the volunteer as well. And so I think that there are other ways that befriending can work. So you can, I know the Marmalade Trust and previously the British Red Cross had a Community Connectors programme where the befriender is almost connecting you to other services and support, rather than just being that sole person that becomes a friend for the individual as well. So I think we're really thinking about what befriending in a way that can be more sustainable in the future and support that individual to connect with others. And I think, just lastly, I'm not necessarily an advocate of technology in itself, but sometimes we can use technology as tools to connect to others, and there are a whole range of new technologies that can connect people to other people. I don't think technology should replace that personal contact, but we can sometimes use technology as tools to connect people who are particularly lonely. I'm really sorry, we've run out of time. I'm sure we could go on forever.
Yes, I mean, we can pick up, just contact us if you would like to, or within the hub as well. This is a really good space within the hub to open this discussion after this webinar. So if you want, we can have a separate group talking about chronic loneliness. But thank you all so much for kind of being here and taking this time to listen to our thoughts. Hopefully it's been interesting and insightful. And there are a lot of points that I haven't touched upon, and I can see that now going through the chat. But there is only limited time, and there's only limited things that we can say.
But we will answer the questions and post them on the hub as well.
Thank you.